Ask AJ. Hi, everyone. Welcome back to Ask AJ. I'm AJ Hanna from Sykes. And in today's episode, we're going to look at the results of our latest survey on American attitudes towards the use of telehealth. Some of you may remember that in March of 2020, right as the pandemic was really starting to explode and many towns and cities began lockdown orders, we asked people, number one, what they knew about telehealth, and number two, have they ever considered using it? Not surprisingly, while there was a general awareness of what telehealth was, very few people had actually used it. And many people expressed at that time a willingness, because of COVID-19, to at least consider it. Well, not surprisingly, after 12 months, when we refreshed the survey data, we saw an increase in attitudes towards a willingness to try telehealth of nearly 20%. And beyond that, we saw increases in people's perception that they can receive quality healthcare, a quality healthcare experience with telehealth. Now, that number is still only around 40%. And you are constantly battling, as we talked about in previous episodes, you're constantly fighting with the perception that an in-person visit, in those circumstances where the physician can provide a physical exam as well, means that it's a superior form of treatment or superior experience. And so people still have a general attitude, even though they are more than willing to accept the idea that telehealth will provide them a comparable level of care. There is still some sense that people might have a preference for in-person visits. So not surprisingly, year over year, we saw a dramatic increase in the number of people who had actually had a telehealth appointment. And this is consistent with everything that we've heard across the last 12 months at least. Nearly 20% had had a telehealth appointment in the 2020 survey. That exploded to over 60% of people who have ultimately been able to utilize or decided to utilize for one reason or another a telehealth visit. In the interim, in the fall of 2020, we did a very brief update and found that we had had a slight increase, 10% over the year, of people who had actually had an increase. So much of the increase that we see in use of telehealth has actually come within the time period of roughly October to March, nearly doubling the number of people who have had a telehealth visit. Now, the reasons for those visits are pretty interesting, not the least of which being is that in some cases their providers required that they change to a telehealth visit. But we found some interesting reactions in terms of the level of convenience that people feel like they have when they're engaging in a telehealth appointment as opposed to an in-person appointment. Some people actually asked their physicians if they could switch to a telehealth appointment, again, in that effort to try to make sure that perhaps they don't have to be in a waiting room where someone may expose them to the virus. And that many people were persuaded either through their own research, through what they had heard via social media, or from people that they knew about their experiences with telehealth. So that has continued to lead to a very positive feeling about the way in which telehealth can provide basic levels of care. So when we asked specifically what were the things that people were most intrigued about or liked most about their telehealth visit, a resounding 85+% of respondents felt like it made them easier to get the care that they needed. Most people still were afraid at some level of going to the doctor's office, and that the use of telehealth helped ease those fears. And surprisingly enough, nearly half of our respondents said that they feel like that they had a chance to see their physician more often because of telehealth. People also expressed that they feel like their healthcare expenses had decreased and that they felt that they had a more empathetic experience from their doctor, which is an interesting response. And if you consider the typical face-to-face meeting, perhaps with a physician. The physician may be seeing multiple people all at once. There may be other people in the room. There may be scribes taking notes. And so it can feel rushed, and it can feel perhaps impersonal. And many people responded, over a third or nearly a third responded, that they felt that they got a more empathetic experience with their physician and their caregiver over telehealth, primarily because you have that single focus of you being on camera and your caregiver being on camera leads the impression that perhaps you're getting a more attentive level of service than what it may feel like when you're in an in-person setting. Now, most people wonder whether or not after the COVID vaccines have really taken hold, we've reached herd immunity, and we have resumed some level of what normal life would be, whether or not telehealth will continue to be a predominantly used form of healthcare. And over nearly 75% of our respondents believe that it will, for non-urgent care, non-related to COVID, that it will become a standard part of that treatment regimen. And 64% feel like they would rather have a telehealth visit as a part of their annual physical checkups or part of their annual updates. What makes that interesting is that an annual physical or those annual checkups normally require the collection of information, collection of data. 74% of our respondents said that they would be willing to upload information from a smart device, from a smartwatch, or another healthcare data tracking mechanism into a telehealth platform for their physician to be able to get access to during those checkups. Now, we know that data privacy has been a huge concern and is a concern for people who engage in online health activities. But the predominance of people are beginning to see the advantages and understand the safety mechanisms that have been put into place and are willing to share their data via telehealth with a caregiver in order to continue to get those convenience benefits, perhaps continue to get those cost reduction benefits from telehealth, and utilizing it as a part of their routine care. So that's just a few things that we looked at in this survey. A link to the survey will be in the notes to this show. Please feel free to go out and take a look. And if any of you have had the opportunity to experience a telehealth visit, we'd love to hear about your experience. Either leave a comment on LinkedIn or a comment in the YouTube channel or on Twitter. And we'll be interested to see how many of you have found the same thing that our survey audience did about the convenience and the advantages of being able to use telehealth. Thanks, everybody. We'll talk to you again soon.